actually, we are referring to the CDC's website for holidays, and specifically Halloween being the first seasonal holiday that is coming up. Again, I mentioned earlier I'm a pediatrician, and I do know that this is a holiday that children enjoy very, very much. We really are looking at this in terms of phases of risk. I mean, I remind people that if you are having your celebration in your home with your own children, your children might carve pumpkins under the supervision of parents, of course. They might wear their costume, they might do some trick-or-treating around in the house, if you will. Again, many creative ways that parents have learned to cope with this pandemic, or they might have other celebratory activities within their home. That's really the lowest risk because you're with your group, you're with your quarantine bubble. If parents choose not to take that route and wish to do something outside with their children, going around a neighborhood, well, certainly I have read of persons having drive-through parades, if you will, where children, families drive from one house to the next and pick up a sack of treats. Again, that's still pretty low risk. Another opportunity is for children to, walk through the neighborhood with parental supervision and pick up prepackaged treats off of the porch or off of a table in front of a person's house. I mean, that's again, low risk. The risk, what we're really looking at there is that children congregating together in groups. Remember what I said about people congregating and contact. I mean, that's something that we have to remember. The highest risk, and I will say as a pediatrician that, I would tell my patients not to do this. I would tell my patients not to have their children going from door to door, trick-or-treating, putting their hands down in a candy bucket or a candy container and pulling out treats and putting those in a sack and then going to the next door. I mean, I just wouldn't do that. Again, parents have the right to make the decisions about their own children, but I think that's risky. I also think that, a lot of places have the trunk or treat. And again, that's almost like going door to door. While we might have something prepackaged, let's remember we have more people together and going from person to person. The more you congregate together, I think that is a risk. And just finally, again, I'm sure children probably would not think this way, but they might, that if they have on a Halloween mask, that's a mask. It's really not. It's certainly a mask for their costume, but not a mask for reduction in transmission of COVID-19, so we still recommend the cloth face covering. Again, I think parents have been under a huge amount of stress during this, and I certainly understand that. My children are grown, but I do remember the days when my children built up to all of these holidays and just couldn't wait for them. But I think it's extremely important that we as parents develop ways for our children to celebrate, but also continue to keep them safe from this virus and reduce their chances of contracting this from other people. Thank you.
There's inherent dangers to everything that you do. I do believe that parents are the best at gauging this. I encourage everybody to follow the CDC guidelines, and I think the good thing to understand is large group gatherings are discouraged. But again, people have common sense, and I think that that's the best gauge on this issue. But I do think that the CDC guidelines are clear, and I do believe that large gatherings are discouraged. Thank you.